Bladder cancer is especially common among smokers, elderly males, and those who work with aromatic amines, in a sense, paint industries without any protective glove clothing. And it is also common with neglected stone disease in the bladder and some infections of the bladder. The commonest symptom with which the bladder cancer presents is usually blood in the urine. Apart from this, the patient can also experience increased frequency of urination and pain while passing urine. And in advanced cases, it could present with simply a lump in the lower part of your body. It can easily be identified with some urine test like the urine routine, which can confirm the presence of blood, and what we call as a cytology. This, a CT scan, can definitely stage the cancer, which can identify if the tumor is actually confined to the bladder or it is spreading to the lymph nodes and other organs in your body. As soon as a diagnosis of bladder cancer is suspected, the first thing after an imaging will be to perform what we call as a cystoscopy, an office procedure which is a sure shot way of identifying the small lesions, and once we identify them, biopsy of the lesion is mandatory. The biopsy will definitely help us to both identify the stage of the disease. We need to see whether we can remove all of these tumors through a cystoscopic resection, what we call as a transurethral resection of the bladder tumor. This BCG definitely reduces the risk of both the recurrence and the chances of you having a progression of the disease. On the other hand, if we have a muscle invasive variety, then we need to actually look at what kind of cancer we are actually having. A particular type of cancer called as adenocancer of the bladder, we can perform what we call as a partial cystectomy or a bladder preservation surgery. If not for this particular type, and if for the other types of cancer and which involves or invades into the outer coating of the bladders, then we might have to remove out the entire bladder, which we call as a cystectomy. This can be performed with minimally invasive varieties using laparoscopy, and once this tumor entirely is removed, we need to reconstruct the urinary system of the patient, which can be twofold. Either we can create an artificial bladder using the intestine of the patients, or we can create what we call as a conduit, where the patient will be dependent on a small bag placed on the side of his body for collection of urine, and he needs to just go to the toilet and empty it out. More advanced stages of the cancer definitely involves chemotherapy or immunotherapy or targeted treatments which can bring down the size of the cancer, after which we can reassess the patient if performing a surgery on him is going to be beneficial or not. You can reach out to the Department of Renal Sciences, wherein we will help you in understanding and identify whether we have any harmful pathological process going on. Thank you.